Hi everyone, I'm Dr. Lynn over at Rehab and Revive Physical Therapy here in Tustin. Today, I want to talk about going down the stairs. This is in conjunction with another segment where we're going up the stairs. We're going to talk about using walking sticks, walking cane, using the rail, if you're injured, what to do. So this is a very good segment to watch closely. So we talked about previously using the whole foot on the depth of the step. Very important going up. But using the whole foot going down is also just as important. I do want to show you this little demonstration I like to show people. Generally, the most stable is actually your heel. If your heel's on the ground, you can see how my leg doesn't have to wiggle that much. That means there's less torque, less rotation. If your foot flatted or your foot is flat, there's a little bit more rotation, but it's still just as stable. So you can see that it's just as stable. But if you land on your toes, which a lot of people like to do when they go down the stairs, not only do you use your knee more, but you put that pressure right here. You can see the gravity lines. That's so much pressure. I don't have this whole leg, this whole shin bone to take up or absorb the stresses from gravity and my weight. So that's why a lot of people's knee pain hurts when they're going down. This might be common for most of you. So you can see if I can get even away from my toes, even towards the ball of my foot, then we're in good shape. So if you're like here, then you see there's so much more. I have so many more factors I have to control when I go down, which a lot of people do. I'm just exaggerating some of this pressure here. So we have to also think about, as I go up, we have to think about, so how do I land and how's my posture, my regular standing posture? You got to be erect and you got to use your spinal column right over your leg. So what I like to people is, I like them to point their toe up before they start landing, and then they'll end up eventually at the ball of their foot. So you're gonna come down, and you're gonna come down like this with your toes up, and then you're gonna land more towards the ball or the midfoot. In some cases, if you have longer legs. So this is how you're gonna go. I want to keep my posture right up above my midfoot, and I'm just gonna descend this way. And that way I don't have to use as much legs. I'm gonna use as much knees. I'm gonna use my glute muscles. I'm gonna come down like this, and I'm gonna come down like this, and so I don't have to strain, and my knee doesn't have to go excursion. The excursion of my knee doesn't have to go too far forward, and that's a different way of going down. So we talked previously about using the rails if you have an injured knee. If you got rails, those are the most stable. I suggest using those if you've got an injury. So let's say my left leg is injured. You want to go down with the bad. It was up with the good, down with the bad. Good people go up to heaven, bad people go down to hell. So your leg is weaker, it's poor shape, it's in pain, whatever the reason, you have to bring the bad leg forward, or the bad leg down first. So you try to do the same thing. You keep your toes pointed up, and then you go this way, and then you do one step at a time. And if you got rails, you can use them that way too. So that'll take away a lot of stress off that painful leg and the weight. So you can control the descent with the stronger leg on the way down. Just like that. So we're going to go back up again. If you're also, another way to go down, if you're kind of apprehensive and you've got a rail, is to use, let's say my right leg is the weaker leg now, is to use the rail. So what we're going to do is we're just going to go this way, one step at a time. That saves you a lot of stress, and the stronger left leg now can control the descent down. And that's another way to do it. Now, for some people, it's a little bit tougher to do this way as well, and there's hip patients, people with hip replacements that can do it differently. So it's also just going backwards. If you've got two rails, it's always good, and you just go, once again, it's down with the bad leg. Let's say my right leg is the bad leg, we just go down this way. And you're just reversing the order. That's if you're a little bit more courageous enough to try backwards. But this is also very safe. If you've got two rails. So just like that. You always want to use what you have, what's available. And so that way you avoid painful situations. If you got walking sticks, even better, or a cane. Let's say I'm using this as my cane. My left leg is the weaker leg. Now this is gonna always be there to kind of be my crutch. And then I'm gonna go down with the bad leg, just like that. And you try to get your whole foot, once again, on the foot, the depth of the step. That's gonna give you the most support, the most surface area possible. And one step at a time until you get strong. So walking sticks, here, you just use both, down with the bad leg. Don't lose this saying, and then that'll save you from, almost fell, but there, down here. But that's why you have the cane, so you don't fall. Alright, so just watch that, and then that can go together, or you can do this first, one step at a time. This lands, or you can do it together if you're more comfortable together. So they can land together in synchrony. Great. So thank you very much for this segment, and I'll see you guys later. Thank you.